Hi everyone again. We'll continue with Occupational Health Sciences in Public Health. This is part 2 for this series. I'm Associate Professor Victor Ho from the Center for Occupational and Environmental Health, Universiti of Malaya. Last session we discussed about basis of occupational health, work on health and health on work. This session we discuss about principle of identification and control of occupational hazard. So what is the basis of occupational health? Basically, last session we looked at the effect of health on the work and the effect of work on the health. So work on health and health on work is the basic of occupational health. But how could we achieve the two basic principles? How can we ensure that the workplace does not harm the workers, and how do we know what is health needs of each job? We can start with hazard identification, risk assessment, and risk control, or the acronym is HIRARC. HIRARC is the most important part of any workplace. Before you start your job, you need to do a HIRARC so that the job is healthy. Hazard identification. What are occupational hazards? Occupational hazards basically are substances at the workplace, either man-made or natural, that are harmful to workers when they're exposed to them at the right concentration or level or dosage. Example, as we discussed in the last session, dust. And to conduct hazard identification, we must first know what is hazardous. Hazard can be classified or grouped into 5 big groups. They are physical hazard, chemical hazard, biological hazard, mechanical and ergonomic hazard, and psychosocial hazard. The second part of hazard identification is risk assessment. So only after the identification of the hazard, we are able to conduct a risk assessment. So what is risk? Risk, the potential that a chosen action or activity, including the choice of inaction, will lead to a loss or undesirable outcome. The notion implies that a choice having an influence on the outcome exists or existed. That means risk basically means that you have a choice either to do it or not to do it. So by identifying the risk, basically you give the choice to your worker to take that choice. And risk can also be possible loss or injury, a dangerous element or factor. So risk is the potential of the hazard to cause harm. Let's look at a revolver as an example. The risk of a revolver range from potential to cause injury and to causing death. Risk depends on the situation. Revolver alone without the bullet would be low risk to cause death. Bullet alone is also not a risk. A hazard is a risk only under specific situation or condition. In the above example, only a loaded revolver is considered a risk. Exposure. A loaded gun is only a risk if the gun is pointed at you or someone. That is called exposure. How often would a loaded gun be pointed at you? This is known as exposure, and the measure for exposure is a number of time or duration that you are exposed. Risk. The risk we are discussing in occupational health is similar to the concept of absolute risk in epidemiology. The risk can be rated as high, medium, low, or by a numerical risk estimate. Exercise 1, we will look at hazard identification. The situation is a fast food company delivery man. Job description, to deliver the company's product, fast food, within a given time frame, 15 minutes, to ensure freshness of the product. So your exercise is to identify the potential hazard. After identification of the hazard, then we can continue to look at risk control. This control is the control of a hazard which depends on the hazard itself. We will discuss about hierarchy of control. It's known as hierarchy of control because you start with the most effective method and then proceed to the next less effective method. And it consists of elimination, substitution, engineering control, administrative control, and last, personal protective equipment. In case of the revolver, what do you think as an effective control? Eliminate the revolver? Okay, so we have legislation that restrict the ownership of guns, like in Malaysia. Substitute. We can substitute a gun with a less lethal option, like pepper spray or taser gun. Engineer control. We can have smart gun, a personalized gun, firearm designed to reduce the misuse from RFID chip or proximity device, fingerprint recognition, magnetic ring or microchip. Or we can have administrative control where we can use a gun lock. So we can lock the gun every time we are not using the gun. You can lock the gun in a cabinet, or you can store the gun in a bullet separately in a locked cabinet. And last but not least, we can use personal protective equipment. So let's recap. What is hierarchy of control? It is elimination, substitution, engineering control, administrative control, and personal protective equipment. This is the most important part of control. We start here, not here. Now, the second exercise is for you to identify the control based on the hazard you have identified in your first exercise. Thank you for your attention.